Today's October 27th, 2017. We're here with a very famous ozone health practitioner. His name is Julian Holmes. I'm using your whole name. He's a dentist from South Africa, very famous in the ozone world for pioneering a lot of stuff. And we're also here with Howard Robbins. And the reason why we're here today is because I'm having my quarterly training workshop on ozone. And Julian, you had a significant medical problem lately, yes?
2 years ago I basically died of heart failure. I was very fortunate, the right people were there at the right time. I have a pacemaker, but gradually my cardiac output has become less and less and less, and moving around has been a huge effort. And I've gone from like 100% to like 1% of what I could do.
Oh my God. And it's also curtailed your dental work as well, correct?
Yes, I mean, I'm fine sitting in front of a computer. So basically I now develop courses and I write protocols. I invent new products, but trying to do dentistry, just trying to do ozone treatment for my patients is pretty much impossible.
Now, I saw you last night,
Yeah.
and you could barely walk into the restaurant.
Yep.
You needed assistance, and I saw you with
Yep.
a cane. So I want to see what you're able to do before you get any treatment, okay? I want to see the extent of your ability to do anything. So I'm going to ask you to get up, and if you need his assistance, ask him for it and walk to the door.
Well, I'll try and get up by myself first,
Okay.
and then we'll go from there. Howard, I am going to need some help. Thank you.
And you're breathless.
I am. That would be one term. I would probably use something that probably I shouldn't say it on YouTube. Yeah.
Okay. Are you able to walk to the door and back, or you think you can do that?
Can you let go, Ham?
Mm. And Howard, I believe just before you came over here today, he had trouble tying his shoelace. Is that
No,
right?
he put on one shoe and couldn't tie put the other one on. He was out of breath. It took him 5 minutes before he could put his next
Oh
shoe
my
on.
God. Okay.
So I need to
At
sit
the
down.
airport,
You
he
need
was
to sit down.
wheelchaired.
Guys, sorry, I need to sit down. Sorry.
Okay.
I'm
He
sorry.
was wheelchaired at the airport all around because he just couldn't do anything.
Thank you. Now, Julian, I'm really sorry to see you this way.
It's okay, just let me get my breath back. Sorry to interrupt you, Robert.
That's okay.
Apologies.
And the purpose of this is to catch you before and after this guy's direct intravenous ozone gas treatment. And then I'd like to be able to put you up on YouTube if we see what we expect to see with
Yeah.
your permission.
No,
Is that-
absolutely.
Okay.
I-
Thank you very much. And we're going to repeat this after you've had some sessions.
Okay.
Now, were you having any pain then, or just shortness of breath and exhaustion?
It was just shortness of breath and just no energy at all. So
Okay.
just getting up, as you saw, was an effort.
Yeah.
I have to make sure I'm carefully balanced. My number one fear is if I'm alone, if I topple over and I'm on the floor, getting up is going to be a huge issue for me.
Understood. Okay. Thanks. We're going to do this again after you've had a few
Okay.
treatments, okay?
Yeah.
Thank you very much.
My pleasure.
And I have your permission.
You have my permission to
Thank
use
you.
this.
Today's the 28th of October. This is the second day of our two-day workshop. We're back with Dr. Julian Holmes and my Sierra Leone blood brother, Dr. Howard Robbins. You have had 4 DIV, direct
Yep.
intravenous ozone gas treatments since yesterday,
Yes.
correct?
Yeah.
And when we first saw you, you could barely do anything.
I struggled. Well, no, I didn't struggle. Without either one of your assistants, I couldn't actually move. I mean, it really was that bad.
And I remember we went to a restaurant the first night, and I needed to hold you up just to
Yep.
wait for the car to pull up, and you
Yep.
were walking with a cane.
Yes.
Can we see what you can do now?
Oh, yeah. So, for me, it's a huge change. I don't need the stick for balance any longer. I don't need it to keep my balance and keep upright. Every now and then I have a slight dizzy spell, but I just need to sort of hold on to something, let it pass, and go on. What I have noticed is before I was having real problems holding my head up. You know, I was actually walking like this, looking ahead of me. Whereas now I can stand tall, I can look straight ahead. I need to learn how to relax my belly when I walk, because at the moment I used to hold myself rigid so that I could actually sort of control myself. But now it's a huge change.
I think part of it, holding your head up, is because you're getting better perfusion to your head.
Yes,
You had to keep it down because your brain wasn't getting perfused.
probably, true,
Now-
absolutely.
What you're considered in the ozone world a master. You're a dentist. What are your thoughts on what you experienced yourself with this man's DIV treatment?
We have a lot to learn.
Would you have believed it?
No.
Wow.
I'll
Tell me more.
be quite honest with you, I had read about this. I expected changes maybe after maybe a week or 2 weeks. I was completely unprepared for almost the immediate change. And for me, it's my immunologist actually summed it up very nicely. He said, you know, you've gone from 100% to 0%. And it's going to be so nice to go back to this guy and say, well, actually, Robert, I'd like you to have a look at me now. What do you think now? And my cardiologist, I don't even want to begin to speculate what he might or might not say. He was very ambivalent about me coming because I discussed it with him. My wife, I think, was very afraid that it was going to kill me.
The ozone would kill you.
Yeah. She said, you know, her comment was, well, you're putting all this gas into you. Don't you think it's slightly dangerous? And I said, sometimes you have to believe in what people are saying, and you have to believe that miracles can happen.
Well,
And,
I saw a miracle here because I saw you the other night, and you needed my assistance to walk 30 feet from the restaurant door to get to the car. And now you got up off of that chair without any assistance.
Yeah.
And while I can believe it because I do ozone all the time, I'm really pleased that just 4 simple DIV treatments did this for you.
It's certainly, I'm going to get very emotional now. I never expected to get well. I had kind of reached a point in my life where I'd accepted that was the way I was going to be. And all I can really say to both of you is I love you guys, because you've shown me that, okay, I may be considered to be a dental expert in ozone. I know so little in comparison. So thank you, both of you.
Thank you. And I have both of your permission to post this.
Oh,
Is that
please,
correct?
yeah.
Absolutely.
And a comment from you also. You're a world master of ozone. It's known. What were your thoughts on our weekend workshop? Honestly.
I would like to come and spend a week with you at some stage. I've got a lot to learn, and I would love to be able to take that information and actually teach it in South Africa. So part of what I'm doing with Howard is learning the hows, the whys, the wherefores, what to look for, what not to look for, to take that back, put it into a form which potentially dentists can further help their patients. And try and emphasize the point to these guys we are not just dentists, we're healthcare workers.
You're treating the whole body, and most dentists
Exactly.
don't know it. And you saw
Yeah.
what I do with my muscle testing, and I'm in your mouth.
Well, I've done that part before, and yet you forget it
Mhm.
because you don't use it on a daily basis.
I do.
Yeah.
And I'm not a dentist.
Exactly.
Is this a course you'd recommend to doctors? You've been to Ozone courses for doctors and dentists. What are your thoughts there?
Can I come again, please?
Okay. Thanks.
Brilliant. I mean, it's been inspirational. I've seen miracles, not just with myself, but with the course attendants, where we had one gentleman who was in such pain they couldn't straighten their finger, and yet the following day he's moving his hands without any pain whatsoever. I've seen
That's right. I forgot about that.
I've seen people here who have hobbled for their life because of problems with their feet, and between the two of them you've made it easy for them to walk, and you look at them now and you think you're not the same person. And I've watched the skeptics who've been here say, and you can tell they're sitting on the fence, and it's like, wow, I hope that those people use Ozone. I really do, because Ozone has a part to play, irrespective of what our professional bodies and governments may say. Ozone is medicine, and it works 100% every single time.
Thank you, Julian. I appreciate it. Dr. Robbins, I thank you too.
I'm more than happy to have done what I could do.
I love it when you come, and I hope you'll keep coming to the workshops.
Every time you have one.
Very good.